Hi guys, welcome to my videos. So guys, today in this video I'm going to discuss my opinion about why the healthcare situation in Canada is not going good at all, and some urgent steps and some effective urgent steps to be taken immediately. So guys, if you read news, it's not just about a particular province, it's happening everywhere in Canada. Emergency departments, they have a very long queue of patients waiting for health care, to get care. Patients are staying in pain for hours, if not days, before they are gonna be checked by a healthcare professional. Lot of emergency rooms, especially in rural areas, are being shut, especially during weekends and other holidays, because they do not have nursing staff to hold upon. I think it's not just about investment, it's about filling the gaps. As per my opinion, like considering this kind of shortage, like when healthcare goes down, what's gonna happen? Like people are gonna suffer, people are gonna die. So I think at this time it's paramount that red tapes we remove. Even internationally trained nurses, those who have good experience and they're already in Canada, just grant them license, give them visa, and let them work and serve the people. We had taken similar measures during peak of COVID-19 when I think internationally trained doctors were allowed to assist, if I'm not wrong. I don't remember the exact things that were allowed under those special measures, but the time has come. It has to be taken. I was reading news and there were so many pieces of news that were really scary. Somebody had to wait 7 hours for an ambulance to come. Somebody was like waiting for 20 hours to be seen. There was no nursing staff. Like, it was really very painful. Somebody who went to a hospital in Prince Edward Island found emergency room was closed. This is happening everywhere, and some urgent and effective steps are needed. So I think this is the time that government should uh, step in at a very high speed and get the resources whatever we have on the place, because now summer is almost over, and in fact it's over, and now flu seasons are round the corner. So more and more people, especially more and more seniors, will show up in emergency rooms with various symptoms, and we need to have effective and caring workforce to handle them. Without that, it will be very difficult for them to handle the situation. What are we gonna tell them? Like, don't we cannot tell the patients, right, don't come to the emergency room, right? Because if people have emergency, they are gonna head over there. On the other hand, I have a personal suggestion for the general population. Many times it has been observed that people go to emergency rooms for primary care. Guys, like, if you have a condition that doesn't require, is my personal opinion, because everyone is different, everyone's circumstances are different. If you have a condition that doesn't require emergency care, I like, okay, let me put it this way. If I have a condition that doesn't require immediate or emergency response, I wouldn't be showing up in an emergency room. Rather, I'll wait and I'll go to a walk-in or family doctor's clinic to find out what the solution is. Like, there are so many resources available, like for example, you have body pain, slight body pain. Of course, it could be huge in many cases, something that can be handled. Let's say you went out for swimming, okay, after swimming you are sneezing. So this is something not too serious, and you can I'm just citing general cases. I mean, of course every case is different and there could be some emergency cases also, so you need to do proper analysis. So like, if I have a condition that doesn't require emergency response, something very minor is required, maybe I can be treated by some over the counter medications, or if I need more than that, I can go visit a walk-in clinic, those who can issue a prescription for me for some medication. So if I have like fever, for example, now, and it's not too bad, like let's say point 0.5 zero point 0.6 more than that, and it's not going up, then I can handle, right? I can take some over the counter medication and I can handle till next morning, and I can show up at a clinic and get what I need, rather than going to the emergency room and already adding myself into the queue when the queue is already strained more than their capacity. So this is something I would really expect from the general population, that emergency means emergency. If there is a situation where you need urgent treatment, show up at the emergency, and if there is a condition you are in that can be treated, I mean to say primary care, that can happen at a doctor's office, at a walk-in clinic or your family physician, definitely go for it. Now some people may argue a point over here, and after COVID, what's happening, like lot of doctors are not seeing patients in person for some cases. While I'm no one to comment about it, I would say that just go for it, like contact a doctor, because what I see, like recently I contacted a walk-in clinic and they did the conversation over the phone. But I know that if they want, when you describe your condition to them and they find out, yeah, you need a visit, they're gonna schedule a visit for you. So it's not that they are avoiding. Again, every clinic is different, so I cannot make a generalized statement. But if there is something, like the crux of the story is, if there is something that is not serious or something that doesn't require emergency response, do not show up at the emergency room, and let those resources work for the people, those who are in urgent need. And you can show up at a clinic and get the things done right for you, get medication and all. At the same time, I would request our honorable government at all the level, be it provincial, federal, or any level, that please step up the efforts that you are already taking. I do understand it's not going to be an overnight solution, but the urgency has reached, and this is really important. Like Canada is all set to welcome hundreds and thousands of immigrants every year. So when the number of people increases, we need to have we must scale up our hospital capacity to healthcare capacity, so that these people can get incorporated and get the services they deserve, and it's for everyone. So thanks for watching this video, guys. Please write down in comments what you think about my opinion. Please write down, guys. Thank you.